So hello everyone, and welcome to this HealthLinks session today where we'll be going through the background of HealthLinks, show some analytics and data to support our work, and we'll be going through the benefits of a coordinated care plan, steps in completing a care plan. We'll be doing a quick knowledge break to get you thinking of potential clients that may benefit from a HealthLinks approach to care. And lastly, we will provide you with a list of resources that will help you through this process. So HealthLinks was first started in 2012 by the Ministry of Health and Long-Term Care, and the provincial strategy stated that this is an approach to integrating care for clients living with complex conditions that optimizes sustainable and person-centered care, as well as serves as a model for all the different sub-regions in our area. Just to give you a little bit of background, so approximately 5% of Ontario's population uses 65% of our healthcare resources in dollars. So this is a very small percentage for such a large chunk of healthcare spending. In more recent years, there has been a shift from a programmatic approach more so to integrating the model of care into existing operational and organizational processes, and as well as agencies in the community. The goal of HealthLinks is really to transform the system by increasing access to integrated quality services for clients that do live with complex chronic conditions. So how can we ensure that this strategic vision is actually achieved? Well, firstly is ensuring that these complex individuals have a coordinated care plan, also known as a CCP, as you can see just on the screen. Ensuring that they have meaningful input into their care plan. So sometimes, and oftentimes actually in healthcare, clinicians want to do what they feel is best for the client, but sometimes this isn't what the clients themselves want. So really this is just ensuring that the approach is client-centered and that the client is also able to tell their own story. And lastly is ongoing care coordination amongst partners, so whether this be primary care, home and community care, social service agencies, hospitals, and so forth. So we'll quickly review the target population of individuals that would likely benefit from our coordinated care plan. And historically, the target population followed more of a medical model with strict criteria in order to be considered a HealthLinks client. But the goal includes moving away from a reactive approach and targeting individuals where they are at their absolute worst to a more proactive approach where agencies and frontline staff are able to target individuals more upstream. So the current target population includes those that are living with complex chronic conditions, so have 4 or more. The identified subgroups are people living with mental health conditions and or addictions issues, those that could benefit from a palliative approach with a life-limiting progressive illness, as well as those that are frail. One of the most important aspects is the considerations piece just at the bottom here. So people who may meet the criteria may not necessarily benefit from the HealthLinks model of care, while those who may benefit may not necessarily be identified. Your clinical judgment may in some cases be better than any criteria. So if you feel that a person may benefit from a coordinated care approach, has multiple services attached, and for instance is at risk for declining health, they may benefit from this model. Another piece to consider are the social determinants of health. And we know that social determinants of health make up a large percentage of a client's health trajectory. This can include anything from low income, housing, social isolation. These are all pieces that can be included in a coordinated care plan and are very important parts of it as well. So moving on, to give you a little bit of data, the biggest thing from this slide to take away, and this is based on 2015/2016 information, is that Niagara has the 3rd largest percentage of clients or patients that are complex in Ontario. This is based on 4 or more complex chronic conditions, and this slide really just goes to show that there is a need for coordinated care plans in Niagara. From a hospital utilization perspective, we see that coordinated care plans can make a dramatic impact on the system. And the evidence here shows that coordinated care plans help reduce avoidable use of emergency services and rely less on hospital services. You can see some statistics here in the chart. So this is 12 months after a care plan, and you can see that there's significant reduction in some of the points on the left. And in addition to better quality of life for clients and better work experience for providers, using a coordinated care plan approach will help to ensure that emergency services are available when the community actually needs them. Some of the outcomes of a coordinated care plan include empowerment. So, patients are really able to gain control over their own care and provide meaningful input, as previously discussed. Communication, so, improved communication across different sectors, organization, whether it be hospital to social services, home and community care to primary care. Goal setting, so improved client outcomes with a clear plan to actually meet the individual's goals, and then defined roles and responsibilities for providers. So oftentimes we hear that often there's duplication of different roles, or there's no clear expectations of what individuals in the care team are doing, but the coordinated care plan really helps to define these roles and responsibilities so that everyone's on the same page. In terms of benefits of a coordinated care plan, so it really provides coordination of services using a standardized tool. It enables collaboration amongst multiple providers and organizations, increases communication with the client and multiple organizations, as well as informs you as a provider to discuss the goals that are really focused on what the client wants. And again, that's going back to the meaningful input in that they get to tell their own story. So now we'll be discussing utilizing the coordinated care plan tool. A lot of the points, again, we've already mentioned, but just to give you a quick summary again, a coordinated care plan is a provincial tool to maximize collaboration and communication. It is client-focused. You're able to identify the roles and responsibilities of the care team right on there. It tells the client's story. It supports client-centered goals with a clear plan of action. And this is really an evolving document that is meant to adapt with the client's goals and needs. So this is something that may change over time. It's not one set document that's once it's recorded, it's sort of set for life. In terms of the integrated care lead, so this is an individual that identifies a client who would benefit from a coordinated care plan. So it begins with initial conversations. This integrated care lead would get consent from the client, and then they would start the coordinated care plan themselves. They provide services that are most aligned with the client's goals. They have a good rapport and relationship with the client that can develop and strengthen over time. They're responsible for communication with the client and other care team members. They're the lead contact person for the client as well as the care team. And they can be in evolving roles that clients' goals and needs change. So we'll be talking about that a little bit later on as well with warm transitions and what that may look like. So roles and responsibilities, moving on to the care team members. Some of these include that they contribute to coordinated care plans. So really that includes the development, providing updates, and really supporting, again, the client with their goals and what's most meaningful to them. The care team members communicate changes in the client's health and well-being to the integrated care lead, as well as they use a client-centered approach to deliver services, as well as coordination to achieve the client's goals. This next diagram just goes to show that a care team can be very dynamic and can encompass many different agencies and providers. So again, it's very dependent on the client and what their needs are, and then also depending on the client's health trajectory, the type of service provider, and this may all change along the way. This is a fun analogy that is used to describe a client that's really driving their own care. So you can see the patient, that's just up here, and they're the ones that are driving the bus and directing their own care. And the passengers, all in the back, are all the care team members along with the integrated care lead. They're the ones that are assisting the client in reaching their goals. Some people may remain on the bus while others may come and go depending on the actual needs of the client. So next we'll go into My Goals and Action Plan. This is part of the care plan that highlights the client's goals and action plan and how they will achieve their goals. So the first part is what I hope to achieve. So for example, you can have a client that says, I want to find a new family doctor in Niagara Falls by the end of May. So then we go on to the next section that states, what can we do to actually achieve that goal? So for example, we have Carolyn here as the patient. So Carolyn will review Healthcare Connect or other documents as well. The patient, client, or Carolyn will contact the doctor's offices listed in Niagara Falls from niagaradocs.ca. Shannon will support Carolyn by filling out the physician office applications. Shannon will support Carolyn to register with Healthcare Connect. So this is again her lead that is taking that role and helping Carolyn with whatever her goals may be. And then you have some details here, so I'm not going to go through every single one of them, but you can just sort of see that it's very clear and comprehensive in terms of the dates. You can see when Carolyn has actually been accepted as a patient and ultimately her goal has been achieved. You can see when they went into the doctor's office to fill out the application, and then when other documents were reviewed as well. So you have who will be responsible for that care plan and part of the My Goals in Action plan, so Carolyn herself, which is the client, and then Shannon, which is the lead. And then again, the date is put on the far right-hand column, the date of the goal that was identified. So when creating goals, the recommended practice is to set SMART goals. And a SMART goal is one that is specific, measurable, attainable, relevant, and timely. So this clearly identifies the who, what, and by when specifically. So someone's goal can be, I want to find a new family doctor in Niagara Falls by the end of May, as we'd previously seen with the example. And, it's really driven by what's the most important to me and my concerns section. So the client's biggest healthcare concern was not having a family physician. The next part is start the goals detail with the date to track progression and finish with the person's name in brackets. So you can sort of see from the previous example, you're able to demonstrate your team's progression. So in brackets here, you have the individual's name as well, so you're able to track the roles. And again, seeing with the example there. The goal should be client-driven and use their own words. So remember that a client is actually getting a copy of their own care plan, so this needs to make sense to them and really be clear. So using the own's patient's or client's language is very important. In terms of some successful approaches, the first one is a care conference, so really including the client and members of the care team as part of the discussion. Ensuring that clients are participating in achieving their own goals and that they're really the ones that are driving their own care. Conduct joint visits when possible. So this saves time for everyone. It's more effective when everyone is at the table because you're really understanding the different strengths in a care team. The fourth one here is utilizing the strengths of organizations and role of care team members to reach the client goals. So it's important to remember that different individuals have different skill sets, and it's important to utilize that expertise when bringing individuals to the same table. Keeping the language simple and client-centered, and then lastly, consistent communication amongst not only care team members, but again, also the client. So now we'll be going through steps in completing a coordinated care plan. So this is just sort of a diagram here that illustrates all the different points, and then we'll get into each one of them in detail. So the first step is you're identifying the individual that would benefit from a coordinated care plan, asking the client if they would like to be part of the coordinated care plan while really emphasizing that it's a team-based approach to care. And you'd want to get that consent up front. With the client's input, you will initiate the care plan and begin to build their care team. With the 4 points, we encourage individuals and for yourself to have a case conference and share information with the care team members themselves. And then the last point is just updating the care plan and share it as needed. So for identifying the patient who would benefit from coordinated care planning, so we have the identified subgroups again that were mentioned earlier, so living with a mental health and or addictions issue, those that could benefit from a palliative approach to care, or those that could benefit from a frail approach to care, as well as the considerations, and one of the most important parts again is the social determinants of health, high frequency utilization of healthcare resources, so for example, emergency department admissions, and then using your clinical judgment as well. So, for example, asking yourself, does this client need support from multiple service providers? And if so, would this maybe benefit? So we're just going to stop for one moment, and we're going to do a really quick knowledge check to go through 2 scenarios, and really ask yourself throughout these 2 scenarios, would this person really benefit from coordinated care? Would there be value if the person were to have a coordinated care plan? And then we'll be walking through to see what the process would look like. So this first case scenario, so it's a 60-year-old male who has uncontrolled diabetes, has a history of falls, is currently taking multiple medications, is at risk of homelessness, has no social supports present, is not connected to any services, receives ODSP, has called 911 10 times within the last month, has a diagnosis of bipolar disorder, history of anxiety, and lastly requires assistance with activities of daily living. So, would this person benefit from a coordinated care plan? The answer is yes. And we'll be going through a little bit of the reasoning as to why. So, you know that they're impacted by the social determinants of health, which we've mentioned previously. There's no current supports. They call 911 multiple times. They can definitely benefit from a team-based approach, especially given that they have multiple chronic conditions, no current supports. So this individual would definitely be someone that could benefit from a coordinated care plan. So next individual, we have a 40-year-old female. Boyfriend pawned her valuable possessions. Boyfriend recently left, and they're not coping well. Socially isolated. She has challenges with food security, challenges with transportation. There's underlying mental health concerns that are not officially diagnosed. The hygiene is neglected, and engaged with multiple service providers. So this one's a little bit different in that she is engaged with multiple service providers. So, really ask yourself, would this individual benefit from a coordinated care plan? So the answer in this one is yes as well. And just some of the reasonings here behind it as well. So even if they are engaged with multiple service providers, they would benefit knowing that they have mental health concerns, they'd benefit from a team-based approach, they're impacted by the social determinants of health, and as well we know that there's some financial barriers there. So again, the social determinants of health component can come in. The next step is to invite. And really, it's best to get consent before you begin. And being transparent and having an open discussion while completing any assessments or while inviting the individual to being part of the care team is really an important step. Using simple language, identifying the benefits, and discussing a team approach to care is part of the invite stage. So next we'll be looking at the consent. And this is specifically for participation in coordinated care planning. It allows for communication between the care team, allows for the collection of storage of personal health information, or PHI, and personal information as well on Health Partners Gateway, which is the web platform solution that helps individuals to sort of care plan together and edit in real time. Patients may elect to provide or withhold consent for any of the care team organizations listed at any point in time, and all that they have to do is just select yes or no in the right-hand column, and then the list of the actual organization goes on the left-hand side. So in terms of the client consent form, so this is the clients are provided with this, with the primary point of contact for the coordinated care plan. There is no signature required. Only the client themselves requires a copy. So this is meant to be, just a form for the client themselves that they can look back on at any time. So next we'll be discussing the CCP initiation and update form. So this is really needed to create and open a coordinated care plan and Health Partners Gateway. So this is again that software solution that allows you to update and edit the care plan in real time. This form collects data on mandatory fields. This is as per the ministry's requirements, and as well as it captures participating organizations, whether it be requesting organizations, or this can also be an integrated care lead. But we really all have a role to play in this, and that's one of the most important parts. Next is engaging. So begin gathering information about them and, really building that rapport and building that trust with the client. And some of the things that you may want to add or ask is, what is most important to you right now? What is most concerning to you about your healthcare right now? And begin by setting those goals with the client. And again, make sure to focus it on from their perspective and what is most meaningful to them. And start to identify and build the care team from there. The next part is sharing information and conducting a care conference. So conduct a care conference with the client and the care team. So as previously mentioned, it's sometimes easier to have everyone in the room at the same time, defining the roles, providing clear objectives of responsibilities, ensuring that the integrated care lead is established, setting timelines of what's most appropriate for the client, but also what's most realistic. So not just from the healthcare lens, but also from the client lens in terms of what's most doable to them. Ensuring the client's concerns and goals are addressed is also part of the sharing phase. Sharing the coordinated care plan with the client as well as the care team. So making sure that this is like the passport that's given to the client, that they're really able to track and see what their progress is within their care. So in terms of update the care plan and share as appropriate, you're still working towards the client goals, updating the care plan as required, sharing update with different individuals that are part of the care team, monitoring the client's progress, and then assessing the readiness for transition. So lastly, we'll be talking about transitions in care and asking yourself the question, when would I transition a client's coordinated care plan? So some of the times that you would transition a client's coordinated care plan could be, when the client has met coordinated care plan goals, the client has created a new coordinated care plan goals that no longer require your support. There's a new integrated care lead that has been identified, so you may not be the most suitable person at the time that's needed by the client, or the client family chooses to withdraw from participating in coordinated care management. So in terms of how do you transition a client's coordinated care plan, so this is a discussion that you would want to have with the client to see if it's appropriate both for yourself to pass them on in the client's journey, but as well as making sure that they feel comfortable with it in the next part of their healthcare trajectory. You would then develop a plan for continuity of care with them. A warm handoff to the new ICL or integrated care lead would be created. And then considering a case conference or joint visit, just to really ensure that the information is transferred in an appropriate way and that information is conveyed as clearly and as effectively as it can be. And lastly, and we will be providing you with these resources as well. So these are just for your information here as well. So a coordinated care plan, you have the multi-agency consent form that we discussed, the initiation update form, some guidelines as well that come from the H&HB LHIN, naming different care team members and organizations, and as well as there's a coordinated care plan tip sheet that you are able to request a copy from your manager. Great, thank you very much, and I hope this was helpful.